Thank you. My name is Dr. Sadat. I'm a non-invasive cardiologist in New Jersey and also a medical director with Moving Analytics, a virtual cardiac rehab platform, which I joined about 2 years ago. Oh, thank you. Yes, I noticed that there was an incredible need to fill certain gaps with cardiac rehab. I'm actually a director myself of a traditional brick and mortar, and many of our patients weren't even showing up, or if they started, they wouldn't finish. So one night I was up late looking for an opportunity or find a solution for one of my patients, and I came across Moving Analytics and checked them out, was very, very pleased by what I saw, and then found that they had an opening. I decided to apply, and the rest is history. And thus far, it's been an incredible journey with helping our patients, getting them the rehab they need, the services that they need, and giving them tremendous benefit from a resource that is so underutilized for various reasons. No, absolutely. A big part of this is actually working with the payers to get telehealth coverage. The public health emergency really helped us out, but obviously we want that to continue in perpetuity to be able to provide these services because we've shown we can deliver. But from a payer perspective, we need coverage. For the patients themselves, we want to waive copays. We want to make sure they have connectivity as well. A lot of individuals don't necessarily have Wi-Fi, but our service is actually a data platform that we can use that has smartphones, tablets that patients can receive and use in a synchronous or asynchronous way and get the care that they need. The technology itself is relatively easy to maneuver. We want it to be as user-friendly as possible, so if patients aren't necessarily as tech-savvy, they'll find that it's pretty easy to maneuver through the program itself. From a provider perspective, we also want to help increase the referral pattern. Right now about 20% of patients who qualify for cardiac rehab are actually referred, and of those 20%, not everyone completes their 3-month program. So we want to create systematic ways in which referrals can be sent, because that's what we need to start with. We need awareness and knowledge and encourage physicians, clinicians of all kinds to have their patients, refer their patients to cardiac rehab. But the value is immense beyond that because it helps with other factors as well: mental health, food insecurity, resolves transportation issues, smoking cessation, medication compliance. And the one thing that I really love is knowledge. This is an opportunity for patients to feel really, really engaged and learn about their disease. So we use our platform to actually educate patients so they also feel more comfortable communicating with their primary cardiologist and talking about their lipid management, their heart failure management, and maybe having more of a clinical discussion. Because we always want our patients to feel like they can sit next to their doctor and communicate as opposed to sitting beneath them and being lectured to. So the lectures, the products, the services that are being created here are phenomenal. And I think, if we can overcome certain barriers, healthcare, there's the innovation is here. We obviously want to overcome some of those barriers that we have to getting these, policies and protocols and products implemented in society. But I have learned that there are incredibly, incredibly gifted and smart people of all ages, all walks, shapes, sizes of all kinds who are really engaged in this space. And it's really heartwarming because it does affect everyone. It does affect everyone. It's something that we need to grow. It's something we need to support, and it's something we need to bring to the people of the planet, essentially, because everybody wants to be healthy, right? Do they want to understand the lingo and the polysyllabic terminology? No, they want to be better. And what I've learned here is there are really, really smart people thinking about some of those solutions, and some of those solutions are incredibly actionable, and I really do hope that we get it across the finish line.